Thank you for joining us today, Dr. Green. I was hoping to ask you a few questions about one of your current projects. So, your research as a Center for Public Health Law Research Fellow examines the impact of state level restrictions on public and private funding for abortion care on racial and ethnic disparities in maternal and child health outcomes. Can you share some preliminary findings from this work?
Sure, you would probably be the person to also give those preliminary findings, given that you've been a really integral part of this project. Essentially, what I was interested in was rigorously tracking changes in laws related to mandatory counseling and waiting periods data with respect to abortion. Obviously, Law Atlas has an amazing resource, but it's essentially cross-sectional or has very few years. We're tracking those data back 15 and more years to try to understand how these laws have evolved over time. And indeed, we're finding that more and more states have implemented more and more restrictions. One of my colleagues calls it lengthening and strengthening. So some states are going from 24-hour waiting periods to 48 and even 72-hour waiting periods. Some states are implementing more requirements related to counseling about abortion, giving information that may or may not be scientifically correct or valid. And this has certainly persisted over time. And given the changes that have happened as a result of SCOTUS rulings, I'm sure that this trend will likely continue.
Yeah, it's really unfortunate to see. And we were wondering how these findings could be used to improve health outcomes, particularly among Black women in the United States. Are you able to make any specific policy recommendations at this point?
Well, we're not at the stage where we can make policy recommendations, but I hope that we will be able to soon. Thankfully, there is some of that work being done. Dr. Caitlin Myers is an economist who's been working on this for a very long time. And she has shown that these laws are impeding access to reproductive health care and disproportionately among Black women and women of color. And more important, we can take these data that we are rigorously bringing together and integrate them with data on birth outcomes. And I think that is going to give us a much better picture of how these laws may or may not disproportionately affect Black women and other pregnant people. I think it's important to note that it's not an unreasonable expectation that these laws are going to disproportionately affect this population, given the way our society is structured and stratified, whereas Black people and other people of color, disabled people, poor people tend to be at the lower ranks of the social hierarchy, and they are less able to overcome more stringent restrictions to abortion access.
Absolutely. And you've already touched on this, but my final question for you is where should research in this area go from here? What other things should we be exploring, or what resources such as data, funding are needed to make that happen?
Oh, wow, you're asking me for my wish list. First, I think we need more cooperations across states and other jurisdictions to be able to pinpoint the more precise relationships between these restrictions and outcomes. As you know, some states collect more rigorous data than others. Mm-hmm. Some states are, let's say, more reluctant than others to release their data. And that makes it difficult to really understand the full impacts of these laws on outcomes. Second, I always say this, but science often tends to follow the data rather than the other way around. And we often only measure what we can see. And I believe that what we must do is do a better job of collecting more survey data from the populations that we believe to be most affected rather. And we also must go out and actually ask people using interviews, using qualitative interviews, so that we can truly understand and center the populations that are most affected by these laws. The third thing I think is really critically important is that we need to do a better job of identifying pregnant and birthing people. A lot of the data that we use is often confined to women, and we know that gender expansive populations, including non-binary folks and trans men, also are able to get pregnant and also give birth. And when we exclude those populations, we miss a large part of the story about how these laws are affecting various subpopulations. And I would make a similar argument about disabled populations as well.
Absolutely. Thank you so much for your powerful insights. It's been a pleasure to talk with you, and it's been a pleasure to work with you, and I hope to continue to do so. Thank you so much.
Yes, it was very fortunate to have you on this project. I'm very grateful.